I say never take calcium ascorbate. I'm sure you're probably aware I have another book out there called Death by Calcium, and the title is not an exaggeration. Calcium kills an enormous number of people around the world every year because of what the dairy industry has done, and still calcium remains one of the biggest supplements sales-wise around the world. And let's just put it in no uncertain terms. Above the minimal amount that you need, calcium is a carcinogen. Calcium causes cancer. Calcium promotes increased oxidative stress in every cell in your body, which predisposes you to every disease known to exist to man. And this is why magnesium, on the other hand, is so good, because magnesium's primary role and most people who work with magnesium know this, exert its magnificent effect of good health on you because it lowers calcium levels inside the cell. So when you bring the calcium levels down, you bring the magnesium levels up, then the vitamin C can start coming in and you can start getting a normal cell. So avoid calcium in all its forms.
There's still a pervasive belief that you need calcium to prevent osteoporosis. You want to touch on that?
Yeah, it's absolutely horribly bogus information designed to scare the daylights out of mostly elderly ladies who are affected most by this. Is there a severe loss of calcium out of your bones? Yes, okay. But it's like burning wood. If you burn wood, oxidize it, it puts off the smoke. Well, if you burn bones, oxidize them, the smoke is the calcium, okay? You can't put smoke back into the bones, and you can't put smoke back into the wood, and you can't put calcium back into the bones. Quality bone is vastly more than that. And you do have a lack of calcium in many other things in osteoporotic bones, but what you do have is an excess of calcium throughout the rest of the body, because that's what the supplementation feeds. That's what the osteoporosis process itself does. And they've shown quite clearly in those that supplement calcium of substantial amounts have a 250% greater chance of death. Okay. In the ladies that take a lot of calcium, doesn't really change their risk of osteoporotic fracture, but massively increases their chances of heart attack and cancer. So the point is it bad to have osteoporosis and fall and fracture and maybe die from it? Sure. But statistically speaking, if taking the treatment, which does not improve the disease, at the same time as massively increasing your chance of heart attack and cancer, I mean, the answer is pretty obvious that you need to avoid that. You basically need a balanced diet with normal levels of vitamin D3 in your blood. Vitamin D3, running a range between 60 and 90 nanogram per cc on a blood test, more or less, is what you need to make sure you're taking in and assimilating and absorbing the right amount of calcium from your diet. And you need to avoid the excess calcium foods. It's crazy to ever have a glass of milk. Milk is not a beverage. It should not be a beverage. It's one of the craziest things we do when we start getting our kids hooked on milk as a beverage because we think it's something healthy. It's not.
We don't drink milk. So, yeah, and it should be mentioned, you mentioned vitamin D3, that helps your body absorb and assimilate calcium properly. Right. And just taking calcium supplements just increases calcium everywhere in your body but your bones.
Exactly, but your bones. Everywhere but your bones, right?
Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.